you so much for the invitation back again, and I'm delighted to be here, especially with such esteemed colleagues also presenting. I'm going to start by, I'm actually stealing Tomi Taluhi's start of her talk. When I heard her speak recently at the Maritime HR conference, she started with a very charismatic call to action. I don't have her charisma, but her question was, what change can you make? So thinking about everything you've heard today, and hopefully maybe one or two nuggets of things I talk about now, what change can you actually make? It seems to me that the P&I clubs, the international group of P&I clubs, probably have a significant amount of leverage around mental health and well-being in the industry. So you know best about what change you can make and how you can influence best practice. I'm going to start my talk today with where I ended 18 months ago at the first Wellbeing Day we had here. These were the key messages from that talk. And I thought it might be useful, what I thought was to kind of continue that conversation. So thinking about the duty of care, of course, that employers have around mental health, but also thinking about how many mental health problems are preventable. And that also we need to create conditions on board vessels which promote and protect well-being, but also to assure fair treatment. So some of the conversation that was being had a moment ago around suicide and what Neil was talking about in terms of people asking for help, that people won't ask for help if they feel that's going to be the end of their careers. And that comes up time and time and time again with seafarers. People even do call it career suicide. So it's thinking about how can we assure fair treatment, and because we need to try and encourage people to come forward at an early stage, we need early intervention and not waiting until problems get so difficult and complex that people need to be repatriated or tragically ends in suicide. So we've got a duty of care, of course. Every organisation, every employer has a duty of care to its employees. It's enshrined in the MLC under Title IV that the health title applies to mental health as well as health. But mental health is just as critical as physical health. And I've just added in there some of what the ACAS and the health and safety executives say about mental health. And that for all organisations, and this is British law, of course, but, you know, it is good practice, I think, that employers must do everything they reasonably can to support workers' health, safety and well-being. It's about the foreseeable risks. And employers need to treat mental health as equally as important as physical health. I'm going to have a little sort of caveat here, because it's not only about failing to take care of mental health, it's also about what we do. And Neil there was talking a little bit about the evidence base of what works. Now, as mental health professionals, we have a wealth of experience and knowledge and training around what works. What really worries me is that sometimes what we see in the industry is people reinventing the wheel and coming up with their own ideas about mental health and well-being. Now, I personally really appreciate that the awareness has grown and people are trying to do something, but it's really important that we do the right things, that we use the evidence base and we put into practice what we know is likely to work. Although mental health in the maritime sector is very young, we do have a lot of knowledge in mental health field about what works. So for me, it's about collaboration between experts in maritime and experts in mental health. So we put both sets of knowledge together to come up with the solutions that are most likely to work. In mental health, in physical health, we have this principle of do no harm. It's a fundamental principle, and it's based on the idea that we know as health professionals and mental health professionals that a service, if it's provided without adequate knowledge of the risks or skills or professional competencies, can do harm. And we are seeing some of that in the industry at the moment, I'm sorry to say. We're seeing some interventions that are either just not very effective or potentially could be doing harm. So I just want to put a plea out there, really, that what you can influence is people using strategies and guidelines, information, whatever, that does have an evidence base. So always think about the do no harm principle. Think about your due diligence in the same way that you would with any other safety, whether it's physical health or any other safety management. I would suggest that you collaborate with accredited mental health professionals if you're looking at mental health interventions or guidelines, trainings, services, whatever. A collaboration, I think, is probably the best way forward because there aren't many mental health professionals active. You've got most of them in the room today, but there aren't that many mental health professionals out there. So it does need to be a collaboration until we grow the field adequately. The thing to do is really, if you're looking at procuring services or developing new guidelines or new interventions or whatever, is to look at the credentials of the providers. So ask them to give you, find out who is behind it. If you can't see who's behind it easily on their website, for example, for me, that's a red flag. I want to know who is it that's designed this intervention. When I see who it is, I'm looking at their qualifications. Do they have the right qualifications for the service that they're providing? That can be difficult if you're not a mental health professional yourself, to know the difference between a counsellor, a psychotherapist, a clinical psychologist, an organisational or an occupational psychologist or a psychiatrist. I mean, maybe you all know, but often these are things that are not that well understood. But those titles, many of them, are protected titles, but sadly we can't prevent people who are not in the UK, for example, from using titles that they may, if they were resident in the UK, they wouldn't be legally allowed to use. So we can't prevent that from happening. But it's important to ask about their qualifications, ask about their accreditation. Are they licensed to practice in the field they're practicing in? And ask about their legal liability insurance. I feel a little bit controversial in saying some of this, but I think it's really important because for me, as a mental health professional, the do no harm principle is absolutely fundamental to everything that we do. I set up Waypoint Maritime Community Interest Company now about the time that I last spoke here. So it's very young, but my intention in setting it up was to be a not-for-profit, to be able to support the industry in developing best practice around mental health and wellbeing. So in terms of, I'm mentioning it here partly, but in relation to what I've just said, in terms of, if you want to develop new guidelines or interventions or whatever, I'm really happy to have a quick conversation with people about, we're putting this out. Is this evidence-based? I'm not an expert on everything, and part of my professional accreditation means that I have to work within my scope of competence, my sphere of competence. So I will tell you, I'm not an expert on this, but if I know somebody who might be, then I can refer you to them. But I'm really happy to field these kinds of questions if that's helpful. So back to mental health policy and good practice. As some of you, and especially if you were here last time or you've seen the talk more recently, you will have seen that I talked about mentally healthy ships. Mentally healthy ships was a guideline that I wrote and was published back in 2020. The aim of it then was to explain to shipping operators what good practice would be and to encourage operators to develop policies around mental health. The idea of the policy essentially being to try and get company buy-in from the top to the bottom around wellbeing for seafarers. So that's the idea of the policy. Now, a lot of people seem to have developed policies, and the MCA and the International and the UK Chamber of Shipping have also written guidance of a similar kind of nature now. The UK Chamber of Shipping one came out very similar time to mine, and the MCA one came out a bit later. But so mine is not the only guidance out there. But a lot of companies appear to have taken that on and written policies, which is fabulous. But my sense is, and I may be wrong, but my sense is that for a lot of companies, that's now become a piece of paper that's stuck in a drawer somewhere, or maybe a file in people's computers, and it hasn't really translated into tangible action or felt difference on board a vessel. But within that guidance is the idea of having a mental health action plan. So the policy is saying, let's define the objectives for what we want to see for well-being, and then let's set the direction for those objectives. Let's act on that and evaluate the impact and the progress that we're making. And it's that bit that hasn't happened as much. There's 3 parts to that action plan. The first is prevention and protection. The second is mental health promotion. And the third is support and response. So when people are struggling or do have a problem, what support mechanisms are in place? Most of the work that I've seen is happening in the middle, in the mental health promotion side, which is great. Their wellness activities, their apps, their resilience training, they are, all kinds of activities. Now that's really good. That's brilliant. My feeling, so with that is the do no harm principle, making sure that the guidance we're sharing with people is actually evidence-based. So checking that. My sense is, though, that we are falling behind on the prevention and the protection side, and that there is more that we can do in the response and support side. So this is just sort of some of the wellbeing promotion sort of activities that are out there and that are being recommended from the literature and from various places. But I want to focus on the prevention and protection side a little bit. So there's 3 sort of aspects of this. One is mitigating against the foreseeable risks. Now this is about identifying what those risks are. So Neil just expertly shared with us some of the literature, some of the data out there about the risks for seafarers' mental health, and some recommendations that have come out of that review. Maria and Raphael earlier on this morning also spoke about some of these things with fatigue and long working hours. So we know actually quite a lot about what the risks are. But in both, well, particularly in Maria and Raphael's talk earlier on, it was quite clear that actually, even with a 100-year history of talking about fatigue and long working hours, not a lot is changing around that. Now, so there's that aspect. There's understanding what the risks are. For me, the research is brilliant and it tells us what the most common risks are. But I also think that we need to look at this particularly within specific operational contexts. So, for example, there's one company that I work with that has a fleet that sails from Europe up to the Arctic region, oil and gas run. For a significant part of the year, they're in total darkness. So the risks to mental health in that context are likely to be different than some other context. So we need to think about the foreseeable risks within the operational context. So each company can look at what are the risks to mental health where we work and the way that we work. It's also about cultivating that culture on board the vessel that safeguards well-being. And this is, for example, that investment in leadership skills. So leadership is starting to gain traction a bit more in the industry now. And from what Neil was just saying, there's really good evidence that good leadership is protective for mental health. So this is something we really ought to be really investing in as an industry. And the other thing is about having good reporting and response processes and procedures. So that might be sort of confidential speaking out policies, processes, for example, or for reporting things like safety concerns or bullying and harassment and that kind of thing. So having those procedures in place that people have confidence in, that they can use easily, but they also know isn't going to be prejudicial to them if they do use them. So these are some of the things to think about in terms of protection. I want to go back to the first one, the stressors and the risks. Now, this study was done by Marine Benefits and Insurance Company. They followed a research protocol that the Yale University used back in, I think it was 2019. So it's a pretty good research protocol. What they added in beyond the Yale study is a risk measure of stress. So they used a WHO stress measure. And these are the figures that they found. Now, the cutoff point for very high stress is 20. On average, they found that seafarers were scoring 19.5. So very, high levels of stress in seafarers. Now, this might not surprise you that much because almost everything you read says seafaring is a stressful job. But actually, as a mental health professional, I don't think that's acceptable. We can't, using your words, you're normalising long working hours and fatigue and so on. We're normalising stress in the industry, saying, well, it's a stressful job. Actually, that's not okay. The lowest scores were amongst engine ratings, and 53% of them were highly stressed. I mean, this level of stress is not okay. Stress itself is not a mental health problem, but it is implicated in all kinds of physical health and mental health problems, and in accidents and injuries. So if we want to do something about preventing mental health problems, protecting people from physical and mental health problems, we really need to look at the stressors at sea, and we need to take active steps to mitigate against them. Now, this is tiny, but I thought I'd include it because it came from a training I did just 2 weeks ago, where I asked people in my training, what are the stresses at sea, just to bring it home to people's own lived experience. This is a company that have amazing wellness programs, probably better than most companies. They're doing a lot, but most of it is in that wellbeing promotion section, and very little of it is around actually prevention strategies. So on the left there, you can see what the seafarers said when I divide people into groups and then I give them a different topic in each group. So the group that talked about what factors make seafarers struggle came up with some of these things, and they fit quite nicely with the literature. But these are practical things like getting your spares on time, that actually not having to wait ages for the spares and having to make do with other things, because it's really stressful if you're trying to do routine maintenance and you haven't got your spares. No amount of mindfulness or yoga is going to change that you haven't got the spares that you need to do your job. So this is about kind of, what practical steps can be taken to reduce the stresses on board the vessel. And on the right, I added in some of the things that they said would make for a mentally healthy working environment on board. So stress risk assessments. These are psychosocial assessments of risk. They shouldn't be an office-based exercise. It needs to be done in collaboration with seafarers, so talking to people who are living and doing the job on a day-to-day basis. They know the kinds of things that are causing them stress, and they also have really good ideas about things that could make a difference. And so I'd encourage this to happen, but again, going back to what I said, do it in collaboration with a mental health professional, somebody that has skills and knowledge about carrying out this kind of risk assessment. I would recommend doing what I do is to use key informants within the organisation to hear what they have to say, what they think, do focus group interviews, and then probably follow up with a survey. We'll get a good triangulation of data of what people think and some ideas and recommendations. So that's the potential for stress risk assessment. I've got 5 minutes left and I don't want to keep you from the pub. So the last bit I want to talk about is response mechanisms. So that's everything from the self-help materials, port welfare services, helplines that we've heard about today. One of the things to be aware of is barriers to access to that, and we've talked about stigma. And for me, and also I was heartened to hear Neil say the same thing from the literature, that actually training leaders on board is a very effective way of changing the culture, opening conversations about mental health, and teaching people how to recognise the signs. So, for example, I developed a Maritime Mental Health Awareness training probably in 2020 or something. In the last few years, we've, in collaboration with ISWAN, this was, we trained more than 5,000 officers. 98% of you can see the figures there. The training follows a look, listen, link, WHO sort of psychological first aid model. The idea is to train people to be able to recognise the signs of people who might be struggling, teach them first response skills. We do the practice of listening skills. We teach people listening skills. We then get the officers to practice listening skills. We use real kind of case scenarios to practice with, and we look at how difficult that was, how easy that was. We brainstorm around that. it builds that confidence for people to be able to have the conversation if they notice that somebody is struggling on board. When I do this with groups of officers, I always start with asking people, have you ever come across this problem on board the vessel? It's really rare that we get anybody that says never. Most people say that they come across it either often or a lot. And so it's really unusual that somebody says, I've never come across it. So this is about building those skills, building that confidence. Where are we? 98% of the participants said they could recognise the signs better and were more confident in doing something about it. So as I say, up until just very recently, that's been done in collaboration with ISWAN. It's now something that I'm offering directly through Waypoint Maritime, and I'd really appreciate other partners in doing that. I think we've demonstrated that it's a really effective way to support people. My recommendation is that the top 4 on the vessel have these skills. I'd also recommend that the bosun has these skills as well, because what's often the case is that, you know, a senior officer might become aware that somebody's struggling, but actually not feel that they're the right person to have the conversation, that it's just a bit intimidating. And so they might delegate it to the bosun if it's a rating, for example. The other people are the sea-facing shoreside staff. So ones that might need to know how that conversation has gone or how to act or to be able to have the conversation themselves. I was also going to mention the critical incident response training. And so this is training that I've recently developed, but it's about doing training up company staff to be able to do a first response following a major incident. So again, it's using evidence-based practice. It's using what we call psychoeducation, so education around symptoms and normal responses to a major event, a trauma or a critical incident. Supporting people to use good coping strategies and avoiding negative coping strategies. It's about trying to restore functioning as quickly and effectively as possible on board the vessel. Most people will have a reaction after a major incident, but most people will also recover. But about 19% of people will have what we call an acute stress disorder after a major incident, and about 80% of those will go on to develop longer-term post-traumatic stress disorder symptoms. If we can support people in those early stages and give them good knowledge about how to recover as effectively as possible, we've got lots of information about what helps recovery and what hinders recovery, and we can support people to use good coping skills after a major incident. One of the interesting things from trauma research, I used to work in the traumatic stress clinic in London. I was there for about 8 years, and I was there during the London bombings, and we provided the response to the London bombings for everybody that was affected by that. But one of the interesting things for me around trauma research is that the recovery environment is really important in people's recovery. So so that whole idea about peer support, creating a positive recovery environment after a major incident is really important. I'll skip the nice guidelines, although they're very important. So there we are. So that's it. I'm going to stop there. I'm 2 minutes over. Everybody wants a drink, and we've got questions before we get there. So thank you all very much for listening. If there's anything that kind of has piqued your interest, do get in touch and have a conversation. I'm very happy to talk to people, even if it is, just a conversation about thoughts and ideas or following something up. So don't hesitate to get in touch. But thank you very much for your time.